our patient Eleanor. Eleanor is back after 4 years. We did a MaxHarvest Plus hair transplant procedure. Eleanor was wearing wigs and hats and having to constantly cover up because she was just unhappy with her hair loss. How was the procedure for you?
Oh, it was great. It was very comfortable, and in fact I fell asleep in the middle of it, and it was easy.
All right. And the healing process, everything?
Everything was fine.
So nothing unusual, no strange swelling, nothing weird?
Nothing weird.
Do you remember how long it took for the hair to grow?
Fast.
Fast. Oh,
right
good.
Away. Right
oh,
away.
That's pretty unusual for females too. Usually they're a little bit slower.
No, it was pretty fast. Yeah.
Okay. And Eleanor is a great patient. She's doing her part at home. She's using the minoxidil. Now, how soon did we get you out of the hats and the wigs?
As soon as it started to grow a little bit, I was running around.
Back in business.
Yeah.
And how has that changed your life as far as activities and relationships and things like that?
I'm not embarrassed anymore.
Okay. That's real, and that's important.
Yeah, because I wouldn't want to leave the house or anything because I was bald,
Yes.
and going out and staying active.
Yeah.
Going everywhere, it's great.
That's awesome. Now, what are your friends and family saying?
They're amazed.
They're amazed.
They're amazed, yeah.
Okay.
Yeah.
And what brings
Very
you
happy
back?
For me.
And
I'm greedy. I want more.
okay, awesome. So Eleanor was a terrific patient. She has one of these amazing results. When you see the before photos, you'll see she was virtually a class 6 almost, pretty much, for a female. 5'6", I know they do it a different scale, but just to compare it to the men's. And women happen to be extremely challenging to get results like this in a single procedure. They do. I'm very selective as far as the females I'll even do surgeries on, because it's a, you have to have faith, which you did.
Mm-hmm.
And if you don't have faith, you will never get the results. So I could do this job on another female patient, and they'll look at me and say, I'm not happy. And where it's just a subjective situation, and you had the right attitude, and I'm so happy for you that it worked out the way it did.
Thank you.
So today we're going to do another big case for you. We're going to just kind of load it all up. Are you trying to change something or just fill it in?
Just fill it in.
Fill it in.
A little bit more in the back.
Awesome. Okay. Right now I'm going to show you off a little bit if that's okay. So I'm just going to leave you right where you are. So basically we went through and we completely restored her hairline all the way around. We took this where we brought the hairline down and around. All this has been reestablished throughout the whole frontal hairline. And then I'm going to just have you gently tuck your chin down towards me, please. So we went through here. All this is new hair that you're seeing here. You can just take the comb through it and look at that. Nice and full. And she has a challenging hair type because it's a little bit of a finer hair type. But look at that. Look how full that is. Just amazing. And now I'm just going to show you a scarf here. So when we do that MaxHarvest procedure, and let me just kind of spin you this way. And I'm going to just show the hair from the back, so just kind of tilt a little back towards me, please. Thanks. So just kind of look at this. So you can see it from all the different angles. We built out the spiral. I mean, just look at this. Just beautiful one procedure result. As good as it gets. So the suture line is what everyone focuses on. And if I remember correctly, Eleanor was searching for FUEs originally. Correct me if I'm wrong on that.
No.
No? Okay.
I did a lot of research, and
I don't see.
after seeing your results, you were the one.
Okay. So this is going to be a little tricky, but this is the suture line right here, if you can see that. Is that visible, Josh? Barely. Okay. You did great. Look at this. Look at this.
I don't think the folks at home are going to see.
Okay, so this underneath this metal is the suture line. So that little line right there. So let me just take it all. I mean, it's unbelievable. You just feel perfect.
After seeing that, I could see how someone would want to get 2,000 polka dots.
Look at that. You can't even see it. Look at this. That's it right there. Unbelievable. Your suture line, I kid you not, is literally as good as it gets. You can't see it. Right there would be it. That's it. Let me just show the whole thing. So there's no smoke and mirrors here. So, right there. Is this? It's the suture line. And all the way around. Wow, it's perfect. Look, you can see it here a little bit. This is it.
And how many hair case was this?
We did a huge case on her. Do you remember how many hairs we did?
No,
I don't know.
I'm
Me-
sorry.
Me either. Okay.
I'm past memory age, I don't have to
We did a
remember.
monster case.
Wasn't it like a 60 centimeter?
I got everything I could on her. Whatever. I truly don't
Like
remember.
12,000
off the top
hairs,
of my
I
head.
think.
I don't remember. I truly don't remember.
Yeah.
But anyways, it's phenomenal.
Thank
Phenomenal. I'm super happy for you. So anyways, what do you say to the person at home who's thinking about doing this, who's kind of on the fence a little bit?
Do not hesitate. It makes such a difference in your lifestyle. Get it done and be happy.
Congratulations.
Thanks.
And thanks for doing the video. I appreciate it. And we're going to do another awesome job for you. Okay?
Okay, I'm ready.